Good morning, everyone. Welcome to our keynote session for today. I'm going to wait just a little bit until we get to about 50 people in this call, and then we'll go ahead and start it off. Okay. Well, welcome to the 2026 Digital Health Summit brought to you by the California Telehealth Resource Center, or CTRC. As you know, the theme of this year's event is Bridging the Gap, Digital Health and AI for Smarter Care, Stronger Teams, and Sustainable Healthcare. We're really glad you can join us for today's opening keynote session titled Setting the Foundation, Statewide Digital Health Priorities under California's Rural Health Transformation Program. I'm Rebecca Brooks. I'm going to be your moderator today, and I serve as the Executive Director of CTRC. During the session, we'll be hearing from Jacob Parkinson, the Data Exchange Framework Program Director of HCAI. So just quick disclaimer before we jump into it. This session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any of the organizations related to commercial products or services discussed during this summit. Next slide, please. Great. Here's a look at what we have in store for you today. As you can see, jam-packed with great information. Just a quick reminder that you do need to register for each session to join. So if you haven't already, the registration link was just put in the chat by Crystal. Thank you so much. There's still time to sign up. Share it with colleagues that you think might be interested in some of these sessions, and we hope to see you throughout the day. Next slide, please. Great. And just to level set with everyone, we're working on Microsoft Teams today. Here's a little bit of a navigation 101 for y'all. So as you can see, the chat button, encourage you to engage with us there. If you'd like to speak, we have options to raise your hand or react. The reactions are great. Let us know that you're there. You are all muted on entry, so please note that. And we are recording today's sessions, so please keep an eye out for an announcement and us sharing those sessions later on. Do want to share that these recorded sessions will be posted on the CTRC YouTube channel. And if you encounter any technical issues today, please reach out to a member of the CTRC team, either on the platform here, or you can connect with us at caltrc@ochin.org. Also want to share that we're going to hold a last few minutes of today's session for Q&A and encourage presenters and attendees to really be able to keep this conversation going as if we were in person all together, but we're doing this in the virtual space. Of course, I really want to give a big thank you to the organizations that make CTRC and something like this happen, our funders. So the work of our CTRC would not be possible without support from the Health Resources and Services Administration Office, HRSA, and their Office for the Advancement of Telehealth, and the California State Office of Rural Health, Department of Healthcare Access and Information, HCAI. So really appreciative of the partnership here. And without further ado, I'd love to introduce y'all to your presenter for today's session. Our guest speaker is Jacob Parkinson. Jacob is a public servant committed to delivering tangible, measurable improvements in the quality and costs of health and social care. As Program Director of California's Data Exchange Framework, he helps lead the state's efforts to connect health and social service organizations through secure statewide data exchange. Before entering public service, Jacob worked in the private sector, building tools to automate healthcare administration, reduce physician burnout, and make care delivery more efficient. His experience spans clinical care, health tech innovation, and community resource integration, always with a focus on practical, accountable, and transparent solutions. And with that, Jacob, the floor is yours.
Thanks, Rebecca. I think we can mute it. That's perfect. So I do want to thank, before I start, the CTRC team for having me here today. California is a really good opportunity to start building a strong digital backbone in the rural areas of the state with a new source of funding. And so we're going to talk a little bit about how we think we can actually take advantage of that. I saw some familiar names in our participant list today, so thanks for everyone for joining, and happy to stick around for some questions at the end. But let's jump into it. We're going to specifically be going through California's Rural Health Transformation Initiative, and we're going to talk about how rural California really is, the opportunity we have to start supporting those communities, and what the state's strategy is to actually do so. We can go to the next slide. So despite having some of the nation's major metropolitan hubs, California is actually quite rural. Over 82% of the state's in a rural census tract, touching nearly every county in the state. And hundreds of clinics, health centers, hospitals are supporting millions of California residents in these areas. Next slide. So the California Rural Health Transformation Program is the state's implementation of the Federal Centers for Medicaid and Medicare Services Rural Health Transformation Program, which is a $50 billion national initiative to start strengthening rural healthcare, and it was authorized by H.R. 1. Now, these federal funds are distributed across all 50 states through a semi-competitive application process over a 5-year period focused on strengthening access, quality, and sustainability of rural healthcare systems. Now, the program is designed to complement but not duplicate existing state and federal programs, and it really does that by trying to target gaps in rural health delivery, workforce shortages, and infrastructural limitations that weren't addressed through other funding streams that currently exist. Next slide. Now, CMS defined several permissible uses that we could start leveraging the funds for, but it did give us some flexibility in how we structure our awards, including allowing some of our decisions to be based on our own data, the readiness of our organizations, the likelihood that they are to succeed. And really, our program is intended on focusing on what we believe to be viable, transformative efforts for our state. Now, we've been instructed that these funds are not going to, and they must not be used, rather, to backfill any cuts to Medicaid, which will total much more than $50 billion. But we certainly do agree with the goal to uplift and support these rural communities. Next slide. Now, I won't dive too much in detail on this slide, but just to say federal funds are awarded in each budget period, and those that must be expended throughout the following federal fiscal year. And this cycle is going to repeat annually for 5 years. Now, bottom line, we're in budget period 1, and those funds must be obligated by October 30th of this year and actually expended by September 30th of next year. And these are tight timelines, especially in year 1. And each year, California is going to be assessed by CMS on how it's doing. Based on a recalculation, we might receive higher or lower funding amounts in each of the following years. And all of that is really based on how well we are doing. Are we hitting our metrics? Are we hitting our benchmarks that we defined in our original grant application? Next slide. Well, in December of 2025, California was announced that CMS was awarding California $233.6 million for budget period 1, the first year of this 5-year program. And that really launched the first phase of our California Rural Health Transformation Program. I'm going to refer to it as CAL or HT throughout this presentation. Now, this $233 million, while it was the 3rd largest award nationally, it was one of the smallest awards in terms of rural per capita population. But onwards we go. Now, this program is led by the Department of Healthcare Access and Information, and it really focuses on transforming access, quality, and sustainability of rural healthcare delivery across the state. Now, all of California's initiatives that we originally applied for were approved for implementation, and we're going to go over each of those initiatives shortly to talk about how it really will transform the rural state's digital backbone. But let's go to the next slide. The goal of the program is really to build a connected, resilient rural health system where every rural Californian can access timely, person-centered primary, maternity, specialty, chronic disease, and behavioral health care close to their homes. Now, the program is built around, as I said, 3 integrated initiatives, and all of them were approved by CMS. The first is the transformative care model. The second is rural health workforce development, and last is technology and tools. Now, to give a high-level summary of each before we dive in, transformative care is really all about investments in regional hub and spoke care networks, expanding telehealth services, e-consult, and evidence-based care models in those areas. And it's really intending to strengthen the local capacity to reduce avoidable out-of-area travel for care. The next initiative is rural workforce development, which is supporting workforce pipeline programs, clinical training capacity, and targeted recruitment, retention, and relocation incentives tied to service commitments in these rural communities. And the last is our technology and tools initiative, which is really all about investment in foundational infrastructure. That can include things like EHRs, data exchange and interoperability tooling, telehealth expansion, cybersecurity, and more. Now, together, these 3 investments are focusing on strengthening regional systems of care, and like I said, really stabilizing access in those rural communities in the face of incoming cuts. The bottom line here, the core goal is to help rural residents avoid long travel for their healthcare. Next slide. During the application period, we engaged over 1,600 stakeholders. This includes hospitals, FQHCs, tribal organizations, behavioral health providers, community organizations, health plans, local governments, and more. And really, as we talked to these folks, what we heard was their priorities are access to care, it's financial stability for those rural hospitals, it's telehealth and remote monitoring tools, it's workforce recruitment and retention, and it's really all about modernizing the digital infrastructure. Now, we have a lot of different previous webinars with these stakeholders on our webpage. I would encourage you to check some of these out. But just to say, we're going to be holding more webinars with stakeholders, informational sessions, and office hours as we approach the request for application season and grants start to open up for these funds. Next slide. So as I mentioned, California's Rural Health Transformation Program is built on 3 interrelated initiatives that came out of the stakeholder engagement that we were conducting throughout the end of last year and early 2026. Now we're going to walk through each of these individually, and I'll start with the transformative care model. This initiative intends to establish regional hub and spoke care networks across the state, linking rural service providers, hospitals, clinics, tribal partners, and specialty providers. Now, the initiative is really going to focus on implementing evidence-based models such as Project Echo, OB-Nest, CalMap, and perinatal psychiatry supports. It's going to expand telehealth, e-consult, and remote patient self-monitoring for various types of providers. It's going to strengthen local clinical capacity to reduce rural hospital bypass and try really make an honest attempt at keeping care closer to home. Next slide. Now, as a part of the transformative care model, we will be issuing transformative payments. Now, CMS requires that transformative payments be directed only to financially viable, strategically important rural hospitals that are capable of implementing the transformative care model components. These funds cannot be used to cover operating shortfalls or reopen closed facilities. And there are going to be multiple criteria to select transformative payment hospitals. That might include having fewer than 200 licensed beds or operating margin greater than 0.01%, a number of different factors that we'll take into consideration when we're issuing these payments. But the $35 million that we're dedicating to do so will be administered to hospitals that meet those criteria, and we estimate that's going to be between 8 to 14 hospitals across the state. Next slide. Now, the next pillar of our program is technology and tools. The Tech and Tools Initiative intends to modernize rural infrastructure, and that includes we're going to give funding for electronic health record modernization, for health information exchange and interoperability tooling, for cybersecurity tooling, for practice management tools, and more. And the goal of these investments is to support long-term sustainability of the organizations. Now, The initiative it will provide grants for telehealth expansion, revenue cycle improvements, and digital tools for patient self-monitoring as well. Through this initiative, we're going to launch the Rural Technical Assistance Center, which I really want to highlight here because it's going to provide direct support, including implementation assistance, technology coaching, interoperability enablement, EHR optimization, really all of the assistance these organizations need to know how to approach using the funding to maximize their sustainability and their care. Now, the Technical Assistance Center will also be providing some planning support in terms of best way to purchase a different vendor or tool. And these professionals can be available both through remote services, but we'll also have folks providing hands-on support at these facilities, depending on the complexity and the extent of the services needed. So that Rural Technical Assistance Center will be stood up throughout this year, and we'll look to leverage those experts as organizations start to use this funding over the next 5 years. Go to the next slide. Now, the last pillar of our program is rural workforce development. And through this initiative, we're going to be developing a statewide workforce mapping and planning tool to identify county and sub-county workforce gaps. We're going to build pathway programs for students in community colleges and high schools even earlier to gain exposure to health profession careers. We're going to build and expand on education and training programs for allied health through advanced practice providers. And that's going to include developing clinical placement networks in different rural communities across the state. Now, we'll support upskilling and apprenticeship programs, which will enable existing entry-level providers and individuals pursuing health professions to advance their careers. And lastly, we're going to offer relocation and retention incentives tied to long-term rural service commitments. Next slide. Now, budget year one, which we are in right now, is really all about stabilization and assessment and trust building with these rural communities. Years 2 and beyond is going to start moving into what we consider transformation and sustainability for these orgs. We've dedicated 5 different budget year 1 initiatives. And the first for our technology and tools program, which I want to just highlight for this group, is our EHR modernization grant. The state will be awarding $11.6 million to rural organizations to adopt or replace an existing EHR. So that's the starting point for technology and tools. Next slide. Now, as I mentioned earlier, timelines are very tight in year 1, and we're going to be moving quite quickly. So we're hosting webinars throughout the year. Would encourage you, if you're interested in accessing these funds or supporting this initiative, to attend these webinars. And we'll also be standing up a policy council, which will be a good way to get involved as well. And we're going to talk more about that policy council in just a moment. The last thing I'll mention is applications for funding are going to be made available very soon in this summer. Next slide. And once HCI actually awards a grant, it's going to be submitted to the Center for Medicare and Medicaid Services for their review. All grants that we award, sub-grants, must be reviewed and approved by CMS. And funding will actually be dispersed in the late summer, early fall of this year. So very soon. Next slide. Now, to maximize planning time for prospective grantees, anyone who wants to access this funding to start transforming rural care, we're going to start releasing grant guides to help the planning process, and we'll subsequently will open the portal for application submission. Now, the department is making every attempt we can to streamline this process. We're going to do our best to minimize the burden on applicants by only asking for what is absolutely necessary at every stage of the process. These RFAs are going to be released in the summer, so very soon, likely within the next month or so, with award reviews coming in the summer and fall of 2026, and then funds dispersed later in the fall. Next slide. Now, as I alluded to earlier, HCI will be standing up our Rural Health Policy Council, and this is really a public advisory forum for rural stakeholders to discuss implementation, to surface challenges to our department, and to provide some subject matter expertise as we look to evolve the program over the next 5 years. Now, tribal consultations are already underway to identify tribal appointees, and the first Rural Health Policy Council meeting is planned for next month, so very soon. And the participants who will actually be convened in this council, their selection is well underway, and we expect to announce that soon. But I would encourage all of you to really plug in here with this council to both learn more about the opportunity and to share your experience as we, like I said, grow this program. And we'll go to the next slide. Just to briefly talk about the timeline, I want to close by saying that everything is moving quickly here, and so a lot will be stood up concurrently. As you can see, just by a brief snapshot, there are a lot of moving parts that are starting this year. And really the goal here is how can we start to build a digital foundation this year and then build upon that over the last 4 years of this program. We're really looking forward to building more and more into this program and allowing organizations to leverage tooling like our Technical Assistance Center along with the funding to actually start transforming the care that they provide. So I want to thank you all. We can go to the last slide here. I want to thank you all for taking the time here. Like I said, we're very excited about these funds. We certainly don't believe they're enough to support some of the Medicaid cuts, but we certainly are excited about the opportunity to support our rural communities with this funding opportunity. So if there are any questions, happy to answer them.
Thank you so much, Jacob. See some virtual claps. Yeah, folks, if you have any questions, feel free to put them in the chat, or you can raise your hand and we can get you off of mute. I don't see any questions yet, so we'll give folks time to type in. I guess one question for you, Jacob, while folks are thinking on it, is there an aspect of the RHT funding that you're most excited about? Where do you feel like some of the biggest opportunities are?
Well, I'm certainly a bit biased. So my other hat, besides help supporting on the rural health transformation side, is I am the program director for the state's data exchange framework. And really, we're all about connecting through data organizations across the state. You know, we believe that in order for care to be brought closer to home, that means that these patients are going to need to be connected to specialists across the state. And when you're connected, you can't just be connected virtually through telehealth tooling. You also have to have the data connected. And so interoperability is certainly something we're excited about in advancing that. But at the same time, doing that in a way with strong cybersecurity and doing it in a way where providers can adequately bill for the services with appropriate practice management tooling. So there's not really one, but I will say I have a bit of a biased hat that I wear in this program.
Love that. And yeah, data is everything. Oh, I see some questions coming in. So from Noor asking, is there any way we can get notified when each RFA gets released, like a mailing list, or should we regularly check the HCI website?
Yeah, so there is a CalRHT page to the HCI website. I would encourage you to just Google California Rural Health Transformation Program. And on that page, there is a mailing list. We also have an email, calrht@hci.ca.gov, where you can reach out anytime with questions. But if you get on the mailing list, then we'll be sending out any RFAs as we produce them. And I think the best way to get on that mailing list is just to send an email to the email address, which I'm going to drop in the chat right now.
Wonderful. Thank you for that. Another question from Heidi. So, partner with applicants? Is there a vendor resource list?
Sorry, you cut out just back one more time.
Oh, yeah. So Heidi's asking, is there a digital tool to support workforce training communication? What is the best way to partner with other applicants? Asking if there's a vendor resource list.
That is an excellent question. I do believe HCI intends to partner on preferred vendors for this service, but the Technical Assistance Center will also be providing some support in terms of providing shared purchasing opportunities, connecting other facilities with folks in their region to approach this. We know that it's very difficult for individual organizations often to purchase singular licenses to expensive services, and we think there are opportunities for shared purchasing. So there absolutely will, and I'd encourage you to follow along, especially as we build out the Technical Assistance Center, as they will be kind of supporting with much of that.
Wonderful. Yeah, this is a year from how much has evolved and what's opportunity available to everyone. So Fran asking, how do you envision community-based organizations or CBOs and new entrants to provide support to folks such as community health centers and doulas being integrated and funded? So thinking about the workforce development side of this.
Yeah, we think they are critical, and this funding is really available to any facility or organization that's providing program services in rural California. And there are some definitions of what we mean by rural California, but as long as these organizations are providing services in those areas, we think there's a real opportunity to get them funding. Now, it's gonna every RFA will vary depending on and we'll have some different factors that will go in who is capable of applying. But just to say, these types of organizations are critical to supporting rural care, and we really want to see them in the fold as we do this. We want to see them being capable participants in these regional hub and spoke networks that we're intending to stand up.
Excellent. Okay, so thinking about our, Medicaid or Medi-Cal eligible patient populations, how do you see RHTF helping rural providers help the Medi-Cal eligible patient population? Specifically, do you have a vision or ideas for how rural providers can implement digital health systems to help their patients qualify for exemptions or exceptions, or even find community engagement opportunities related to, I think, the work requirement?
Yeah, so I think the key here is we can't use this funding to support specifically with any cuts to Medicaid, and we can't use this funding to replace any or supplant any existing funding stream. But just to say, we do expect there to be some opportunities here for organizations to come in and implement new tooling to access revenue streams that they haven't been able to access before. And we plan to do that through two ways. One, to invest in practice management tooling and things like that have prevented organizations from meaningfully participating. But two is to provide education on best opportunities, best billing programs, and things of that nature. And so really we think through funding the infrastructure and providing education, that's the best way in for folks.
Great. Yeah, love that there's some options to support the sustainability of really critical rural providers through all this. Jerome coming in with a question. They're stating that they're a digital specialty provider company. Is it best for us to apply for grants in conjunction with rural health FQHCs or critical access hospitals, or will there be a vendor list that they can be added to?
Yeah, thanks for the question, Jerome. Would encourage you to reach out at the email that I shared, just to say Many of our initial grants will be awarded directly to organizations. So we will not be, at least initially for the Tech and Tools grant, we will not be awarding vendors themselves, but the organizations who wish to contract with those vendors. So you are welcome to work with any FQHC to help them support an application. But the FQHC, for instance, we need to apply for the funds, and that could change. We might evolve these grant programs to begin awarding vendors throughout the program, but to start, we'll be largely focusing on organizations, on the specific healthcare organizations.
Great, thank you. We are at the bottom of our list of questions. So unless anything else comes in, I'm going to go ahead and wrap us up here. Thank you. You can see there's the email on the slide here, as well as what Jacob put in the chat. Thank you so much, Jacob, for making yourself available to answer these questions and really make sure that all of us on the call have the supports and information needed to really make the most out of this opportunity. So with that, we can go ahead and jump to the next slide. So for ongoing support, please make sure to check out our website at caltrc.org. You can find any upcoming events, new webinars, our on-demand resources, and so much more. Or you can always reach out to us directly at caltrc.org. And wanted to do a plug again. If you were on our opening session, this will be a repeat, but going over to the next slide, we have our 2026 AI cohort. So really are really proud to host the 2026 AI cohort series in office hours as CalTRC. This series builds on the strong foundation and success of what we did a year ago in 2025 with our AI bootcamp. Hopefully some of you are there and are ready to expand your learning and deepen your learning for practical application with AI. This again is no cost. It's a virtual cohort designed to support all of you all at healthcare organizations in exploring and advancing the use of AI in a way that's practical, responsible, and of course aligned with real-world care delivery. And as a part of today's summit, all attendees have the opportunity to complete the first 3 sessions of the cohort series, as you can see here on the slide. And we'll continue the series with 3 additional sessions offered in July and August, along with dedicated office hours to provide you with the support, any discussions, and shared learnings. And if you want to learn more about the upcoming sessions or access resources, register for our office hours, please check out the Healthcare AI Bootcamp page, which Crystal just put in the chat. And please, there are about 90 of you on this call, which is amazing. And we would love to hear back from you, understanding how this was helping you, how we can improve as well. So please complete our short exit survey. Really want to make sure that what we're doing is meeting your needs. And this really, we do utilize it. We read everything and it informs the types of programming, tools, and resources that we're able to develop moving forward. So just quick questions there, which I see the poll has popped up. So folks can click through that as I continue to close us out. And lastly, please sign up for our newsletter. It's the best way for you just to naturally get updates from us, any updates on the resources that we have available, new trainings, and really anything that you need to keep on navigating in this space. So I do see that there are some responses rolling in from the poll. Thank you so much for giving us that feedback. And as we kind of close out, I just want to give one more big thank you to Jacob for being here today and you all for being on this call. We look forward to seeing you at our next session.